I have the pleasure of being your moderator for this session. We have 4 presenters who are going to be sharing their experience with satisfaction and resiliency in healthcare. And I'm going to introduce each of them. We have first Kamille Sherman. Dr. Sherman grew up on the family farm in central North Dakota, and she completed undergrad studies and medical school at UND. After completing residency training in family medicine at Altru in Grand Forks, she practiced broad-based rural family medicine in Dickinson, North Dakota for 12 years before joining the medical school as full-time faculty in the family medicine clerkship and rural opportunities in medical education. Her special interests include end of life, rural workforce, and social determinants of health. Next, we have Michelle Montgomery, who is the wellness advocate for the Department of Psychiatry and Behavioral Science at the University of North Dakota School of Medicine and Health Sciences. She works with medical students and residents on the clinical campuses, educating them about personal practices to maintain wellness and resiliency. She provides support for students, trainees, faculty, and staff under personal or situational stress. And she's also the assistant director of the interprofessional education and teaches mind-body medicine, an elective course for medical students. Next, we have Alan O'Neill, and Alan is CEO of Unity Medical Center in Grafton Family Clinic and Park River Family Clinic. And then lastly, we have Dr. Matthew, tell me if I pronounce it wrong, Viscito? Close.
We say Viscito.
Viscito. Okay, Viscito. Okay. Dr. Viscito was born and raised in New Jersey and attended Stevens Institute of Technology in Hoboken. He attended St. George University School of Medicine and completed residency in family medicine at St. Joseph's Regional Medical Center in Paterson, New Jersey, where he was also the chief resident. After he graduated from residency in 2018, he moved to North Dakota, where he joined an independent primary care practice in Grand Forks and then opened a private solo practice. He was ultimately recruited to Unity Medical Center in Grafton, where he has been full-time since 2017, serving as the chief medical officer. All of our presenters have indicated that the presentation will not include any discussion of commercial products or services. Dr. Viscito has indicated that it will include discussion of off-label or investigational use of products or services, in that bamlanivimab is authorized in the EUA only and is therefore considered investigational or experimental, but no other disclosures by our presenters. So I am going to turn it over to our presenters. I am going to put in the chat box your pre-test for this session. If you've not already filled out your pre-test, please be sure and do that. And then I will be posting the post-test near the end as well. And just for our presenters, just so you know, you'll see my camera come on at 5 minutes, and I'll probably give you an announcement that you have 5 minutes left. And then we'll do the same at 1 minute if you're not close to wrapping up yet. So at this point, I'll turn it over to our presenters. Thank you very much.
All right. Thank you, Tracy, for that nice introduction. Okay. Thank you. Welcome, everyone. So we'll click through our initial slides here pretty quickly. So your objectives here, we want you to learn some strategies that our local rural healthcare administration can use, specifically looking at the local culture in a positive manner. We will show you some evidence-based rural physician satisfaction measures. And then we hope that each of you online here today can name and apply some resources that you can use to improve your resiliency and coping skills. Next slide. We don't have really anything to disclose. Next one. So we'll talk a little bit here today. We'll kick off with one community story, and today we're including Grafton. At UND School of Medicine, we are so lucky to have community-based teaching partners. The teaching physicians are supported by their local communities, the healthcare administrators, and everyone in the healthcare facilities. We would not have a functioning medical school without the support of these clinics and hospitals. Dozens of them exist across the state. In putting together today's presentation, it is fantastic to partner with a few leaders from Unity Medical Center in Grafton who can share that community's path to growth that includes bringing medical learners into the fold on a frequent basis. Next slide.
Okay, thank you for the introduction. We appreciate it. I'm Alan O'Neill, CEO of Unity Medical Center. I'm going to get a little bit operational here for a few minutes on where we've come as an organization and kind of where we're going. When I guess I arrived, 7 years ago today? How about that? Happy anniversary! Yeah. Anyway, it was an organization that was underperforming, and the issues were house-wide. They weren't just concentrated in one area. We were in poor financial condition, and there was an absolute fear of spending or investing anywhere. And I think a lot of that had to do with there was an overall lack of knowledge on cost-based reimbursement and how it applied with Medicare and in North Dakota Medicaid patients. So they didn't know how to leverage it. And we had quality issues, we had volume issues, and it was kind of one big package deal. So as a new CEO, I knew I needed to quickly gain perspective. And obviously arriving here, spending some time in the hallway, I'm not a believer in hearsay or, here's how we've always done it, and that's as good as we can be. And I think there was an accepted concept we're doing what we can. We can't be any better. And I'm kind of a data-driven guy, and there's an old saying that I often quote. It says, "In God we trust, all others bring data." So when you started looking at the benchmarks and just the standards, industry benchmarks, if you're an MGMA member, HFMA, whatever, it was pretty easy to see that we had, in my opinion, I looked at the audits, I looked at the health department reports, everything I could find, I absorbed it. And then I knew I wanted to hear from the folks in Grafton in our community. So my first 2 weeks on the job, I squeezed in about 30 to 35 interviews with internal, external individuals, people in the organization with a mix of backgrounds and relationship. I talked to present board members. I talked to former board members. I talked to community leaders. I talked to UMC department heads, UMC providers, UMC staff members. And I used the SWOT format with my questioning: strength, weaknesses, opportunities, threat. And I said, tell me about the strengths of Unity Medical Center. Tell me about the weaknesses. Tell me about the opportunities. And tell me about if we don't change something right now, we're going to go over the bridge. That's the threat. So I got fantastic information. I assured the participants that the comments were confidential. I wasn't looking for names, but rather experiences or observations that create favorable or unfavorable opinions in the community and with our organization. And then along with those opinions, I asked, what do you think UMC should look like going forward? And the feedback I got over that 2-week period was amazing. It was incredibly useful. And after I filtered and digested the comments, I summarized and shared with the board and the department heads. And basically what you have then is a rough draft of a strategic plan. You have some go forward opportunities that you can flesh down and move forward with. And of course, I had to throw a little bit of a let's buckle up and hang on, because we're going to start doing some things around here. And it was great support that I received, that nearly all the department heads voiced their support for change. They were probably the most supportive group. Providers were more reluctant. They were kind of nervous about it. But the internal observations I came away with was, well, we were underperforming as an organization. Change was needed. And I have another analogy. If you don't remember anything else, you'll remember a few of these. The only one who really welcomes change is a wet baby, because it creates anxiety. People worry about it. It's a whole new order of doing things. But we needed to change. And the first thing we needed to do was get some financial stability, because we didn't have that. We had very little cash. I mean, they had even set up a reserve account at a local bank to cover payroll. We had never had a black bottom line. I mean, we're always running in the red, and it seems like we're leaping from lily pad to lily pad to keep from falling in the water and getting bit by the snapping turtle or something. And another thing I believe in too, and I have a business and finance background, and actually have worked in that for many years, but I also believe no margin, no mission. That if you don't have sound financial principles in place, you can be as well-intended as you want to be, but you can never get ahead unless you really get your finances laid out. And I don't mean just, booking revenues. I mean service expansion, which serves a need and gets people excited in the community, and then also does have a financial reward to it. And again, looking around the facility, it was a very outdated facility. Hospital was built in 1956. They'd done some renovation to it. The clinic was built in 1990. It was very much in need of renovation. All of the equipment, without pretty much any exception, was outdated. I mentioned productivity under benchmarks. And there was a lack of consistency. And overall, what I heard from my conversations and my observations, we had a poor reputation for quality in the community. And that's what hurt the most. I mean, the other things, are tangible. You can work toward those, gaining those. But when we had a poor reputation in our community, that people said, you don't want to go to Unity Medical Center. You want to go to one of the area other cause, or you want to go to Grand Forks or Fargo or wherever. That's what really stung. And it occurred to me, and I use a lot of analogies, that we needed to adopt a sports analogy, get back to basics to improve it. And that is blocking and tackling. If you're a football fan, you get to the basics. In healthcare, it's about the three-legged stool: safety, quality, and patient experience. And if you can nail those down, you're going to see organizational improvement. So we added some key positions to grow the finance area and to grow the service area. Focus on service expansion and financial improvements. We did some simple things, like even implementing an urgent care clinic. We added service lines, which really has helped us out, helped us with the community. And we set out to really improve customer service. We had some turnover, as you would expect. Anytime there's a new order of things, there's going to be change. So we managed through the key turnover. We presently employ 15 full-time providers. We have 4 outstanding primary care physicians, and they're outstanding. I'd send a family member to any one of them. And we have the rest are mid-levels, nurse practitioners, and PAs. Of the 15 providers we have now, only one has been here for 5 years or more. So we had a complete wholesale change. But again, it was a number of things that led to some of the turnover, but overall we're in a very good place. We have many new department heads: lab, radiology, nursing, clinic, plant operations, IT, emergency department, pharmacy, and we've been able to recruit and retain some really outstanding leaders in these areas. I think, and it's an accurate comment, that our present provider team and our leadership team is very talented and very passionate group. I think we're all working together, and I know Dr. Viscito will speak some to that. And once you have that level of commitment at the top and throughout the organization, you can push the passion button out throughout the organization and externally to the community and the region. And the community begins seeing it and feeling it. And again, once you start growing financially, because we did just some internal things to strengthen our cash flow and things like that, just following up on accounts and getting things in order. You can really, once you can start breathing easier, that we're making payroll, that's not a problem. Now we can start buying equipment. You can take the shackles off your leadership team, allow them to grow with their ideas and implement new strategies, which help with continued growth and establishing a new culture. And one of the other key things I was really passionate about, and I know Dr. Viscito was too, we wanted to establish our presence as a teaching and learning organization. And our primary focus or strategy with that was to establish good relationships with educational institutions, primarily the UND School of Medicine. And we also established, opportunities for role rotations and welcome students. I don't think there's a week that goes by we don't have a student out here.
In some department.
Yeah, in some department, yeah. And from other areas too. But we also work with other organizations, other institutions as well, because that dynamic learning environment is so contagious in a good way for the whole, not just the organization, because you bring all these folks in, they got ideas, they're fresh, they're state of the art, everything that they're talking about. That is infectious in the community. They love talking about the med student that came in to see them during their primary care visit. I mean, they really do. It's contagious in a good way. So I think the external factors, the community and region began to come around and realize that they could get quality health care right here at home, that we could do a lot for them. And they're very supportive and very vocal about getting as much care as close to home as possible. That is their goal. I mean, even things that are way beyond their scope, they'll ask Dr. Viscito, can't you do that here? And it's because of the confidence and trust in the care we're delivering, and it's not possible. So thank you, Kamille.
Sure. All right, Michelle, why don't we advance? So this is Dr. Viscito's piece of the story.
Good morning. I'll mention it here, but I'll point out that I really enjoyed the typo in my bio where I graduated residency 10 years more recently than I really did. It was 2008. I wish I was 10 years younger, but so yeah, I've been here in Grafton full time now for 4.5 years. I had finished all my training, as my bio mentioned, in New Jersey, graduated residency, and actually had been recruited to a private practice in Grand Forks where I was for 5 years. And then I opened my own practice and I was doing basically solo practice with one physician assistant for 3.5 years. And I knew Alan during that time period, and he began working on me a little bit to come up and visit Grafton and spend some time here. Around that time, we had a senior physician that retired, and in order to kind of help fill a little bit of a void, I started coming up one day every other week. So twice a month I was up here, and I kind of joke with Alan that I think that was really the start of his long game in getting me to come up, because the push to sort of try and get me to come up full time started then. And as I practiced here more and more, I really started to appreciate how especially grateful rural portions. We don't hear it. Where members of the rural community are super, super grateful to have quality and competent care right in their own neighborhood. As Alan mentioned, I mean, frequently I'll have patients want to know, can I stay here for this? No, ma'am, you're having a heart attack. You need to go see a cardiologist. They really want to have their care as close to home as possible. And being from New Jersey, Grand Forks is super rural to me. I still marvel at how people think of, Grand Forks as the city, and I kind of chuckle to myself, being from the area that I'm from. Then I come to Grafton, and it's super, super rural, and the patients really they know everything about everybody, and the staff knows everything about everybody, and that really gives you an interesting perspective on their history, and there's so much information additionally available. But truly, that appreciation that they have for care really was striking. Other things that really drew me up here, the providers that are from here, really are passionate about, providers and staff and the nurses are so passionate about providing good care to their friends and neighbors. These are the people they see at church, every weekend and at the store and all this, and they truly are even more invested in taking really super good care of people. And additionally, as far as recruitment goes, taking advantage of some of the resources available, I was offered student loan repayment because it was a rural community and the state has those programs available. So that was a huge draw and has been for a number of the people we've recruited. It's a huge piece that really can help promote our mission. So take advantage of those things. As Alan mentioned, also a commitment to education. We have med students almost all the time. We have nursing students, nursing practitioner students, physician assistant students, dietary, social work, PT. We have a student in the building basically every day of the week, it seems. And that was something that I was interested in continuing. I had been taking medical students in my practice in Grand Forks, and being able to continue that and see that as a big part of the mission was really attractive. And Alan mentioned, this piece on my slide here, building and rebuilding the right team. Sometimes, people aren't necessarily the right fit. We really started to try to change the mission and really make it clear that going above and beyond, promoting, improving quality and expanding service lines. And we were able to really draw some recruits that shared that passion. And honestly, some of our practitioners that had been here before sort of drifted away. It was just kind of clear that their goals weren't meshing with our goals, and that's okay. It isn't always a good fit, and you can have an amicable split, realizing that goals and the mission aren't meshing. But like this, the Why Choose Local, like I said, patients want to stay close to home. We have people all the time decide that they would just as soon stay here and do everything you can here. I really don't want to go further. And it's really inspiring, the trust they have in us, that they want us to do that. And it is it's very, very unique to the rural community.
I will bring in just a couple minutes here of talking about competence in a rural context. This is based on medical education, but honestly, this really applies to any rural healthcare entity because we need the team to be competent. But again, what I will talk about here was actually designed by rural medical educators to make sure that our medical students who end up in rural communities can do a good job and they can sustain themselves. So we can go through next slide, Michelle, and we'll go through these kind of quickly. So these will be the 8 that I will touch on. And we can go through one at a time here. So next slide. So we talk about adaptability. This is a motivation to move outside of your comfort zone. You want to fill the gap in what's missing in delivery of healthcare in a rural community. So the next competence we need to address is agency, being courageous. As a rural doc or a rural provider, you need to be able to deal with complexity and uncertainty. Next slide. You need to collaborate and be to your community. So make sure that you understand your patients, make sure you get a handle on the community's culture, make sure that we can appreciate tolerance and differences. Next slide. Comprehensiveness means we're just pretty good at a lot of things. Maybe we need to go take some review or refresher courses once in a while so that we can get those who truly need to be moved to a higher level of care out of the community. So we have to be procedurally minded, but able to recognize these truly sick folks and get them where they need to go. Next slide. Another big thing in any community, but let's say it's important in rural communities too, integrity. Do the right thing. Do the right thing for yourself to make sure you know that the care you're delivering is good. Make sure that your family and your patients also know that you are really doing the right thing in your day-to-day life and in your day-to-day work. Next slide. Learning to find some abundance in rural communities where sometimes we feel like things might be sort of scarce or somewhat limited. Use your resources at hand. So again, you need to know what you don't know, find some help when you need some help. Next slide. Making sure that you have some time to reflect. Maybe this means taking some time to work on scholarly activity. This has been really rewarding to work with Alan and with Dr. Viscito, but it took a little extra time to pull in some hours that we had to find to do this, but it also regenerates and renews us. So that if we are able to pull together, reflect on some of our challenges, we shared some of those challenges. We cracked a few jokes. So making sure that we take some time to sustain ourselves is very important in a rural context. Next slide. And then just flat out being resilient. We need to manage our lifestyle. We have to keep everybody in mind, not just our medical training, our patients, but also our families. So we need to make sure that we have some good resilience skills so we can maintain our happiness and satisfaction. Next slide. So again, what we talk about here is everybody working with medical students, but we can broaden this to say everybody working with their medical teams out there. We need to take some time to deliberately develop these habits. And I think Mr. O'Neill touched on that a little bit when he was talking about spending 2 weeks to figure out what are our strengths out here at Unity Medical Center, what are some things that we can do to improve it. And then you just have to keep monitoring this and making sure that the path is going in the right direction. Next slide. So again, just some take-home messages from this. What can we do to make sure that our confidence, our resilience, and our satisfaction is where we hope for it to be and hope for it to go? So hopefully in the next 15 minutes or so, we can teach you a few skills that might help you with your resiliency. Next slide. So again, just to talk about some of these comparing and contrasting elements here, if you feel like you have control of something, you've got a sense of purpose. If you feel like you've got some good support, your team seems strong. If you sense a lack of control, you might feel a little bit meaningless. If you don't feel supported, you'll feel vulnerable. So again, making sure that we're focusing on the left side of the screen here with feeling some control in our situation and feeling supported. That's really, really, really important in keeping our resiliency at a healthy spot. Next slide. So emotional intelligence is something where we just need to pull on all sorts of elements. You need to have self-management, which means behave well. Be aware of what's going on in your organization, in your community. Make sure that you've got some empathy in your bucket. And then just learn to sort of look at your relationships in ways that build teamwork and have some inspirational leadership. Next slide. And there's one busy slide in every presentation. We're a little short on time, but I just wanted to pull in a few things here. So if you're trying to keep your clinicians or your providers, but really anywhere in your organization, if you're trying to keep folks doing well, make sure that you understand some of these external factors, stressors from the community. The business aspect of medicine can be a stressor. Making sure your organization has good leadership is really important. And then you need the right people on a rural team. You know, they need to be able to function well, sometimes without every single resource in a rural community, just their overall personality skills, being able to be in a small community where people really do pay attention to what you are doing. So those are some of the things here that can affect your clinician, provider, and all medical staff well-being. So next slide here, and I believe we go to Michelle.
Yes, so another sort of busy slide. And this is something that we work on, you know, as Dr. Sherman mentioned, medical students. So that's the focus. That's who I work with. But this, again, can be applied to anybody. So, you know, when we think about resiliency, some of the things that Dr. Sherman just mentioned, resiliency is the capacity to respond to stress in a healthy way. It's the ability to bounce back after challenges and grow stronger. It's a conscious effort. That's insightful, integrated, and doing that in a positive manner. And it's about the capacity of a dynamic system to adapt successfully to disturbances, which I think, you know, the year and a half that we've been through, or the past 16, 18 months that we've been through, you know, I think resiliency is hopefully really shown. But, you know, during that time, the stress bucket is a really great analogy. You know, when you think about the size of the bucket, you know, I think we all think we have these large buckets, right? And we can have the capacity for all that water or all that stress or whatever you want to call it that's coming in, you know, but there might be times when our bucket gets a little bit smaller, a little bit narrower, and that could be with some people over other people. So, you know, I think it's really important to think about this analogy. So not only how big is your bucket, what are the stressors that are filling it? You know, when you think about workload, illness, negative feedback, conflict, we all have that. We don't want to admit it, but we all have conflict within our lives. Uncertainty, interruptions, deadlines, budgets, you know, things that Dr. Viscito and Alan referred to, just anything, unclear, conflicts of priorities, lack of sleep, all of these things combine the stressors that are the water that are actually filling that bucket, sometimes to overflowing. So then what we need to think about is how we release that. So I like to call them taps. And you can see that there might be some healthy taps, you know, so these coping skills. There also might be some unhealthy taps, some false taps, if you will. So, you know, there may be things that we think are stress relievers, and they may be for the moment, but if they continue over an extended amount of time, that's what we really need to be thinking about, because all of this combines to affect our well-being. So on this next slide, you know, this is just a definition of resilience, but when you think about it, what it comes down to is our ability to adapt, our ability to cope, and having that potential for growth and change, which I think has been very well documented, very well shown in the beginning of our presentation with what they've done at Unity Medical Center. And just some other parts of resilience, think about the 3 R's, which are rest, routine, and relationships, which I think ties into community. It ties into the rural. You need a team. You know, like Dr. Sherman mentioned, Dr. Viscito mentioned, you need your tribe. You need to feel connected. You need to have the resources, but you need to have that social connectedness. We're born to be connected to other people. So Dr. Viscito, if you want to talk a little bit more about resilience.
Sure. This is kind of an interesting paper from this panel that talked a lot about trauma and stress and the ability not only to bounce back from stress, but how people deal with it, and really trying to actually define resilience. And some of the takeaway points that I thought were really interesting were the fact that you can think of an object being resilient when it resists injury, when it is, you know, if a watch is dropped and doesn't break. They actually commented on the old Timex, you know, takes a licking and keeps on ticking. And a lot of people view themselves as needing to be able to withstand stressors in that manner, and it just isn't the case. I think that a stress management technique needs to include the fact that you have limitations, and that's okay. None of us are limitless in our ability to withstand stressors and take load on our shoulders. And one of the most important things to do is to not only recognize your limits, but to accept them and then figure out a meaningful way to deal with them. So Dr. Sherman mentioned, we're in rural America and we don't have all the resources we might need to take full care of somebody. We need to be able to recognize that and deal with it. Expedite transfer to somewhere where they need to go, and that's okay. People are very okay with that limit, that, okay, we can't do certain things here, but then seem to be more stressed about personal limitations. I had put that disclaimer about the EUA only because I wasn't sure exactly how far our talk was going to go and if we were going to get clinical or not. But as we were going through this presentation, and I realized that we really didn't actually talk about the fact that the last year has been the most stressful almost any of us are probably going to see in our careers as healthcare personnel, and didn't really directly address that. And I think that one of the things that has helped me is to realize that we are all and have been doing the best that we can with the resources and the information that we have. And that is really all that you can be expected to do. Do the very best you can with both the resources and the limitations that you're given. When a patient is not doing well and is not responding to the treatments you're giving, if you're giving the right treatments, it's not your fault. You are not doing ill by that person, their disease is. It's the same thing when you're in a stressful situation and there's more than you can handle. Well, that isn't necessarily your fault that the issues at hand are expanding beyond that of your limitations, and trying to draw upon your social, whether it be social circle or professional circle, is important, and to draw on the power of others is huge. Those collegial relationships are hugely beneficial. And the other thing is you're never alone. In today's day and age of technology, you're never alone. We're out in the middle of nowhere, but help is a cell phone call away or a teleconference away. And this past year really has even further accentuated that, and that's important to recognize and be okay with. And setting up those systems in advance for you to be able to access those resources and know how to do it makes it more rote and easy to do on a day-to-day basis.
And in this slide, we can see resiliency does depend on a trifecta. So the individual, are you doing mindful things? Are you self-monitoring? Are you limit setting? But then we have that community. So as I said a few minutes ago, that sense of belonging and community can mitigate physician or healthcare provider burnout. And so the community can provide that support, as Dr. Viscito just mentioned, connecting with your colleagues. And it might not just be your local colleagues. Because of the technology we have, we can communicate through networking, mentoring, collaboration, and it can be in person, it can be, via these things that we're doing right now. And then lastly, the institution. And, that's key. And I think that that's something that we've seen that Unity is doing. And, when I present to physicians about wellness, I'm sure that's the most important thing that they get to hear about once a year. They don't all think that. And, a lot of times they'll say, it's great. Yeah, you can talk to me about meditating. You can talk to me about exercising, but it has to start at that institution level. So, the institution has to support it. It's in the self-interest of healthcare institutions to support the efforts of all the members of the healthcare workforce to enhance their capacity for resilience. And I think active support and investment from the healthcare institutions is vital to physician resilience.
For our presenters, we have about 5 minutes left.
Okay, thank you.
Just a quick note on that community piece. During the past year, when we really were at the height of our census in the hospital, and we were full to and beyond capacity at times, the community really became very engaged. They were sending or dropping off food, and one of the businesses donated Grafton bucks, which are dollars that can be spent here in Grafton only, but $50 per employee, and it really went a long way. And Alan, and our administration really came out with some great things to do to promote morale, and free meals in the cafeteria and some giveaways on a weekly basis, and really just let the staff know. They seemed like little things, but I really saw the feedback from the staff that they were feeling appreciated. And even in this situation of huge stress, those little things go a long way to tell somebody, hey, it's stressful, but what you're doing is appreciated and seen.
Good. Thank you. Just quick, I know we're running out of time here. Recruitment, retention, just a few bullets on this. Lifestyle is important, I think, when you're recruiting. What's the wow factor? And you have to identify your strengths and align those with your recruiting strategy. You know, and I'm going to be honest with you, North Dakota is at a natural disadvantage when it comes to recruiting, unless there's a compelling reason they want to live in North Dakota. We don't have all of the moderate weather or recreation activities. There's no mountains around here. There's no ocean beaches. So you got to play to your strengths. And a lot of times just looking at your community and drawing the strengths. What are your strengths? I mean, I know North Dakota is a great place to raise family, good schools. Maybe the school's modernized. You know, in our case, we're obviously using our new hospital as a recruiting. Also, we're an independent organization. We feel good about that. And our location can be to our advantage. We're close to Minnesota, to the lake country. We're close to Devil's Lake. And we're only in something that seldom comes up. We're 90 minutes away from our metro area of 1 million people. And that's Winnipeg. Obviously, COVID has shut the door there on quite a bit of that. But a lot of that is communicating to your key recruits and let them know they'll be part of the team. How do they envision what new services would they like to bring? I know one physician that's Dr. Viscito's counterpart, Dr. Marquardt, when we were recruiting him out of residency in Bismarck, he asked if he would be able to do colonoscopies because that was very important to him. And I remember promising him, absolutely, you will. We'll make it work. And that was one of the key criteria. He wanted to do those. And both he and Dr. Viscito do that. And it's a great service line for us. So I think, one last thing, there's a number of industry, and I won't mention any names, industry techniques out there for communication, for building morale, for doing all those different things. They all have strengths. But one thing I really believe in, and it's old school, it's called MBWA. And if you look it up online, you can find it. It's called Management by Walking Around. It's getting out of my office and the other leadership, the other administrators here, getting out of their offices, spending time on the floor, talking to the staff, engaging them, and being sincere about it, including what's going on, because you'll come back with information of things that you can implement or change or adjust to head off a crisis. I mean, that's maybe an extreme example, but that communication is so valuable and they love seeing you. I know one of the things when I started, they said, we never saw the CEO. And I took that personal. I said, you will see me. And they do. So maybe it's I'm too ADD to stay at my desk.
Well, yeah, I can never find him in his office.
Yeah, that's good. That's a good thing.
I can never find him.
But anyway, and that's kind of my wrap up is just sincerity, working with new employees, when you're recruiting, letting them know how they will be part of the team, asking them what their vision is and what they would like to, what value adds they'd like to bring. Thank you.
We have about 1 more minute left.
And just on this last slide, just some resilience reminders, different things that you can do. There's some apps on here, different resources that you can look up. We were hoping to have time to actually do a brief exercise, but if you have an interest in anything like that, just let me know. You can, I can gladly hand out my email. So, Dr. Sherman.
All right. Thanks, everybody. I really appreciate the team together to pull this off. I think we used our last couple minutes that we would have had for questions, but I've been watching the chat. I haven't seen any questions come up. So thank you, everybody on this team for presenting, and thank you to our attendees. I think this was a nice session that brought in some perspective from a variety of folks.